in the weekly close-up. The Ebola virus has killed more than 4,500 people since its outbreak in December 2013. The deadly virus is feared to have a negative impact on Africa's growth. To counter that, the continental body is working with regional and international organizations to deter the spread of Ebola. Here in Ethiopia, a modern laboratory center has been established with the view to intensify the national Ebola prevention efforts. The government had so far spent more than $3 million for precautionary emergency medical services. Our colleague Sadat Mohammed Sani has the following reports.
The Ebola outbreak was first reported in December 2013 in Guinea. The African Union has stressed the current outbreak of the Ebola virus disease is the worst that has ever been experienced since the first outbreak in 1976. The outbreak has the potential to have a major socio-economic impact on Africa. The current outbreak will have a negative impact on Africa's growth. The epidemic has also overstretched the capacity of West African countries to adequately provide health care in an environment where national budgetary allocations to the health sector remain lean at best significant.
Ebola is a viral disease that has been there since 1976 European calendar in Africa, especially in Africa and central parts of Africa. First discovered in Congo and Sudan. And then the transmission continued since then, and more than 20 or so outbreaks happened since then. But the worst and probably the one which affects a lot of people is the one happened in 2014.
The African Union also disclosed that lack of human resource and poor health infrastructure is posing challenges in the fight against Ebola. The African Union also urged the international community and African countries to provide adequate support for the effort against Ebola. According to a report by the World Health Organization, Ebola is killing 70% of the victims in West Africa. To tackle the spread of the deadly virus, the world community has been providing support for the West African countries. The African Union chief also stated that countries are not pledging enough and urged African countries to join the fight with full commitment to avert more devastation. The continental body is working with regional and international organizations to deter the spread of Ebola. The European Union has now pledged 180 million euros to the three worst affected nations, while member states have promised an additional 300 million euros. The World Health Organization has also trained 400 health workers in Freetown 2 weeks ago to make up for the shortage of personnel after so many got infected. The World Health Organization on Monday announced that Senegal and Nigeria have come off the list of Ebola-affected countries. World Health Organization Director General Dr. Margaret Chan said Senegal and Nigeria have done remarkable jobs in combating the virus.
On the 17th of October, Senegal came off the list of countries classified as Ebola affected. On the 20th of October, which is Monday, Nigeria will also come off the list because they were very successful in controlling imported cases of Ebola.
World Health Organization will also respect Moroccan government for the postponement of the African Cup of Nations, which is scheduled to take place in early 2015.
WHO has not put any travel ban or restriction on organizing any event. But at the same time, we also respect the sovereign decision of Morocco calling for the postponement of the Africa Cup of Nations scheduled.
Meanwhile, World Health Organization representative to Nigeria, Rui Gama Vaz, has confirmed that Nigeria is officially free of Ebola after 6 weeks with no new cases.
Day 20 of October, 42 days, it means twice of the incubation period. After the last confirmed case of Ebola virus disease was discharged from the isolation ward, having tested negative for the Ebola virus, the chains of transmission have been broken. WHO officially declares that Nigeria is now free of Ebola virus transmission.
Ethiopia has also redoubled its preventive effort on the disease. As part of that, Ethiopia has established a modern laboratory center with the view to intensify the national Ebola prevention efforts. The modern laboratory, Biosafety Levels 3 and 4, began operations for the screening and testing purposes. It is staffed by well-trained Ethiopian professionals. According to Health Minister Dr. Kaseta Birhan Admasu, the country had also launched a new screening machine, a thermoscan thermometer with the capacity to test up to 1,000 individuals per hour.
For screening and testing of the Ebola virus, we need a modern laboratory, what we call Biosafety Level 3 and 4. So we are now able to upgrade one of the laboratories to level Biosafety 3. And 5 of our professionals are being trained in South Africa, and starting from the coming Monday, we will be fully equipped for this purpose.
The new machine and 2 other thermo screening machines are presently operating at Addis Ababa Bole International Airport to test passengers. The government has so far spent more than 3 million USD for the precautionary emergency medical service. Technical committees were being established in regions across the country to prevent the entry of the Ebola virus. Dr. Dadi Jima, head of National Technical Committee of Ebola Disease Protection, noted that Ebola testing and control measures were now available 24 hours a day.
We have a system where we can, trace all people who are coming from the at-risk areas, especially from the West Africa, and also any other person who traveled to Ebola-affected countries. We linked our field epidemiology trainees to this system so that they can follow any person who are in Ethiopia from these at-risk areas, so that they will be they record the temperature of such travelers twice per day, so that they will know that they are safer.
The deputy director affirmed that the country is ready to contain the spread of the epidemic, and in this regard it has prepared 2 Ebola quarantine centers with 65 beds in the capital city. Ebola diagnosis laboratory will also be opened in a few weeks' time, and the necessary training is provided for health workers, the police and the military personnel and hotel owners to prevent the epidemic. Reports show that up to 2,000 passengers from 21 African countries are screened daily at Addis Ababa Bole International Airport. In terms of leadership, the deputy director said the country has established a national Ebola committee that is chaired by Deputy Prime Minister Demeka Mekonnen, and the necessary budget is also allocated for the campaign.